Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care, coming right here from Raleigh. And today I would like to explain more about the qualifications for patients who may be able to have the Implantable Miniature Telescope for macular degeneration. Now, if you look back to episode number 70, we explained some of the basics about this technology, which is great for patients who have macular degeneration in the end stage because it can help magnify images so they can effectively make the size of their blind spot in the center of their vision smaller so they can see better. Now, recently you may have heard that this telescope was expanded its approval by the FDA, where now patients 65 and over can receive it. Previously, the FDA only approved this for ages 75 and up, so this now gives us a chance for more people who may benefit from the telescope the chance to receive it. Now, the qualifications are pretty strict because this is a very advanced device, and not everyone who has macular degeneration may benefit from it. Some of the primary things that we need to check to see if it may be an option, number one, the patients cannot have had cataract surgery yet in the eye that we're planning to put the telescope in. Because we need to remove the cataract or the lens from inside the eye to make room for this telescope, if they have already had cataract surgery, we are unable to take out that lens implant at this time and put the telescope in that location. So you may know lots of people that are older have already had cataract surgery, so unfortunately they don't qualify for the telescope. Other things, we have to make sure that the macular degeneration is not wet or not currently active with bleeding or swelling, and it has to be that way for at least 6 months. Now, patients that have had old wet macular degeneration that may have been treated in the past with laser or with injections in the eye, as long as they're stable and not requiring these treatments, then they may qualify for the telescope. Other people who have dry macular degeneration where they've never had signs of wet, and remember, wet is the worst, the dry ones, they can qualify as well. In order to make sure that people qualify, it's a very extensive process where we have assembled a team here in Raleigh, and there are teams throughout the country that include a cornea surgeon like myself, also a retina specialist to make sure that the macular degeneration is the cause of their vision and that it's no longer actively bleeding, and then also a low vision specialist who will help check the vision and make sure they can adapt to the telescope, as well as an occupational therapist who mainly checks to see that they can get around safely and deal with the difference in between the two eyes after the telescope's placed. Now, if you have any other questions, or if you wonder if you or your family may qualify, please post. We'd be happy to answer them, and hopefully see you again soon next time on A State of Sight.